Hello, good afternoon, good morning, good evening, and welcome. My name's Richard Ishwood, registered nurse, work from a clinic in the UK called Normal Earwax. Welcome to episode 37. This is called nervous earwax removal. It wasn't me that was nervous. And I'm sure the lady, if you're watching, hello by the way, wouldn't mind me saying she was a little anxious about this procedure, which is why you may see a bit of wobbly camera work here and a bit of wobbling. Now, obviously, it's quite scary. If you've not had this done before, and we show all the instruments to the patients beforehand, say this is what to expect, this is what's going to happen, I'm going to put this down, what have you. Because you've got to be open and honest with them. What you're doing helps them understand the procedure. But it can be a little bit scary if you've not had it done before. You're looking at these little sharp metal objects and you're thinking, oh, those are going in my ear. I'm not sure how I feel about that. Will it hurt? Is it dangerous? Do you know what I mean? This lady was quite nervous. Actually, I don't know if she was aware she was doing it, but she was shaking a little bit and very frequently, just a little twitch. So that explains some of the shakiness in this, but also when I'm in there, you've got to be ready, like a coiled spring, so to speak. You've got to be ready to pull the instruments out as soon as you think that there's any kind of twitch or jump or movement towards you. So you've got to be always ready to come out of the ear as quickly as possible. We obviously use our hands to brace the patient's head as well. So if they did move towards you, you've got their heads supported with your hands as well as having the instruments in your hand. So what we've done already, you can see a good old layer of skin at the bottom of that one. Now, looking back on this in hindsight, I probably should have gone in with some olive oil at this point, but I clearly like making things a bit difficult for myself. Did actually do it in the other ear later on. But yeah, as I've peeled it away, it's clearly a little bit stuck there. So what I'm trying to do is peel it away from all the outside edges, wrap it into the middle, and hopefully it all comes out in one go. But yeah, it probably would have been a bit easier if I'd have gone in with some oil there, because it is quite sticky. It's not blocking the tube up too much per se, but yeah, it could have made it easier for myself. Because I quite like watching these videos back because it can help to educate my own practice as well. If I'm looking at it and thinking, why did you do that there? Why didn't you do that there? Always help us to be better, Don't get me wrong, it still came out in the end. I think it probably could have been a little bit quicker with the oil. But sometimes you have to weigh that up with, well, it'll be a bit blurry sometimes or a bit harder to see. You have to weigh it up. But yeah, I probably should have done. It's been a few days since I've posted. I've been very busy in the clinic. I have got quite a lot of videos to show you soon. So I've a bit of a quieter day today, so hopefully I've got time to record and upload a few, which will then get posted in the next few days. As you can see, as we're getting further and further back, it's obviously getting a lot darker, this plug here. Obviously there's a lot of you regulars will know, you watch these all the time. Darker it is, the longer it's been in there. So it's been a good old while. This lady hadn't had this procedure done before, so it could have been building up for a number of years. And it kind of sneaks up on you, where you kind of don't notice, and all of a sudden you're hearing it'll go. Because you can still have a good old chunk in there, but as long as you've got a bit of a gap, sometimes around the edges or even through the middle, that the sound waves can still get through. Won't be that affected, you hear. It might be a bit reduced, but it won't be that affected until the whole thing's full sometimes. So we've already peeled it up to the bottom now. I'm trying to grab it from the top and peel it down. Now, spoiler alert, as with a few others I've done, we don't get every little last speck, because as I've said on a previous video, you have to weigh up the pros and cons of getting every last speck, and is it worth it? Especially when they're quite deep down. Very often it's not. If you think it's going to be affecting anyone's hearing or giving them some symptoms, yes, it would be worth it. But for every little last speck, it would only take someone to sneeze or cough, and then before you know it, you'd be questioning yourself, why were you going in for that last little bit when you probably didn't need to and cause some damage, So we did try and get this bit. This is again where I should have put some oil in, then this probably wouldn't have remained in there. So I tried to gently peel some of that up there. But I didn't touch the ear canal, as you can see here, but the lady, you'll see her little jump in a second, I think. Yeah, little jump there, and she felt that, so it was a bit tender, still a bit too attached. So we left that there. A few little smears around the edges, absolutely fine. But you can see all the eardrum, and the symptoms were relieved, and she could hear a lot better. So this one, a bit softer, this, and a bit mushy, which can be a bit more of a pain to get rid of, but it all comes in the end. And again, we didn't manage to get every little aspect here, but we got enough. And after anybody comes, I always advise them to use maybe use some oil once a week, and it'll make it less likely it'll get to this point again. And a little bit of oil is usually enough to clear up any last little bits that remain anyway. But you do need a little bit of earwax in your ears. Common misconception that you need to get rid of it all, because it helps to prevent infections. You know, there's some antibacterial properties in it, and even antifungal properties in it as well. So a little bit of earwax in your ear is good for you. So this one being a little bit more stubborn here, and as again it looks at this point where it looks pretty much identical to the other one, we've managed to peel it away from the bottom there, and you can see that sheet of skin at the bottom. Now I'm trying to pull that up there, and it's at this point that I thought to myself, ooh, right now, here's where you should probably go in with the oil to lubricate that a bit better, and I think in a minute is what I'm about to do. So yeah, I hope you're enjoying these longer ones. Feel free to let me know, by the way, if there's anything you want to know about me. Any stories? I've got lots of stories. Obviously, a lot of these videos you'll see from others, which I love watching, though I think they're all really great. Are from primarily audiologists. I think there's a few nurses uploading some videos. But yeah, along with a long nursing career comes a long history of stories. Every nurse has got a few stories that they can tell you. I do get asked quite commonly, what's the goriest thing you've seen, or what's the oddest thing you've seen? Now, I saw a lot of things in my career, trust me. Probably the most gruesome thing I saw was maggots, but maggot can be used as a therapy for wounds. But when you find them in places when they're not actually supposed to be there, that can be a little disconcerting, and I have found them on patients. I think it was on the foot, if I remember rightly. Yeah, lots of them crawling in between the nooks and crannies and crevices. But yeah, you can. There you go. We've gone in with the oil there. You can use it as a therapy to get rid of wounds. Some of you might have heard this before. Feel free to let me know if you feel bored by these stories, but I thought I'd share with you a few little interesting stories. So when you do maggot therapy, what happens is you get live maggots that are grown in a lab, and they come in what looks like a little tea bag. And the live in there comes in like a big biohazard box, you know. And what you do, you put these maggots on someone's wound, and what they do, they eat away at the dead tissue, and the wound heals better when all the dead tissue has been debrided, we call it, fancy word for removed. So what they do, they nibble through the edges of this tea bag, because there are little gaps in it, and they eat it all, and obviously the tea bag's growing and these maggots are getting bigger. And what you've got to do every day, you've got to feed them, because obviously they're eating the wound as well, but you've got to keep them hydrated. So you put you take the bandages off, get the maggot tea bag, and put a couple of drops of solution in. I think it was mainly saline that you feed them with, stop them drying out, keep them hydrated, keep them alive, and yeah, you repeat that every day until they've munched all the way through everything. But yeah, that can work really, really well. Wasn't that often that we did that, but it is still done in some specialities, and one thing I used to do. But yeah, I found it on somebody once, and we hadn't put them there, but it does happen. It does happen. So as you can see, when we put that oil in there, when I'm lifting it up, the whole point of it is that the oil is going underneath that plug there, so it's then lubricating and unattaching. Is that word? Unattaching, disattaching. Anyway, it's helping it to come away from the base of the ear canal there, which when you get a good hold of it, which I think is quite shortly, it will be able to come out in one big, it's just about to come. You can see a lot of it slurping into the tube there, and it slides out a lot easier than the other one did. Good old chunk there. Brillo shots at the end aren't huge. There you go, nice clean eardrum there, because the majority of it went up the tube. But I hope you enjoyed that. Thanks for watching, take care, and I will see you guys soon. Bye for now.